Warfarin. Introduction. Warfarin is a blood-thinning medication. It decreases the ability of the body to form harmful clots. Usage. Take the dosage of warfarin prescribed by your doctor, always at the same time of the day. Your doctor will give you enough warfarin to thin your blood without thinning it too much. If the blood is not thin enough, blood clots inside the blood vessels and heart may form. If, on the other hand, the blood is too thin, you risk a longer bleeding time. Longer bleeding can result in an excessive loss of blood if the person is involved in an accident. Severe blood loss can be fatal. The solution is to take the amount of warfarin requested by your doctor and to check how thin your blood is on a regular basis. Instructions. To keep your blood as thin as it should be, you should keep your eating habits regular. Keep your exercise level regular. Check with your pharmacist and doctor before taking any new medications, especially over-the-counter medications and antibiotics. Make sure to tell your new doctors or nurses that you are on warfarin, especially if any type of surgery or injection is contemplated. Tell your doctor if you are pregnant or may become pregnant. If you miss a dose of warfarin, do not take an extra pill to catch up. It is important to keep the amount of vitamin K in your diet steady. Eat a consistent amount of green vegetables every day. It is important to have protein checked regularly. Your doctor will tell you how frequently you should have this blood test performed. When to call your doctor.
I'm Peter Block with the Cardiosaurus Heart Minute, and today I'm with Chris Cannon. And we're talking about some of the new stories that have come up in the last couple of weeks that are of interest. One of those is a story in JACC, which concerns a comparison between the thrombin inhibitor Dabigatran versus the anti-10A agents apixaban and rivaroxaban. This was an indirect comparison, and it's really difficult to understand with all of those comparisons in the previous trials exactly what kind of a conclusion, I guess, is you can reach with this. So they tried to put together all of these three agents and compare them against warfarin. You wrote an editorial on this, Chris. What's your take on this?
Well, it's a very hot topic, obviously. We have three new drugs. Each trial showed benefits over warfarin, and so we then are asking, well, which one of these should we use? And so it's very tempting to compare to that one common denominator, the warfarin. I think what's clear is that each of them has advantages, but when comparing one agent to the other, the problem is that the trials do have differences between them. So some have patients with very high CHADS risk score, others have the full range. There's also differences in how the warfarin was managed, with differences in the time of therapeutic or time in therapeutic range of the patients in the warfarin group. So you can't attribute all of the difference seen relative to warfarin to the new drug. Some of it is the control group in the population.
Right. It looks to me like probably we're still going to have to wait for direct head-to-head comparisons between these agents. I doubt, candidly, that will ever be done. But until then, we'll have to do the best we can, probably going back to the original studies. Wouldn't you agree?
Exactly. I think, these are all large trials, and so each of them individually provides us with very good evidence for what the efficacy and safety is in preventing strokes. It's often less bleeding, certainly fewer hemorrhagic strokes. So I think some real advantages of the new agents, but relying on the individual trials is probably the right answer.
So good agents, but the jury's still out, and we'll just have to wait and see. Thanks. Clinical studies on the prevention and treatment of venous and arterial thromboembolism show promising results for rivaroxaban and dabigatran. As you remember, rivaroxaban inhibits factor Xa and dabigatran inhibits thrombin. A major disadvantage of these anticoagulants is the absence of an antidote in case of serious bleeding or when an emergency intervention needs correction of coagulation. Now in circulation, researchers studied the potential of prothrombin complex concentrate to reverse the anticoagulant effect of these drugs. Healthy male volunteers received rivaroxaban or dabigatran followed by either a single bolus of 50 international units per kilogram of prothrombin complex concentrate. After a washout period, the procedure was repeated with the other anticoagulant treatment. Prothrombin complex concentrate immediately and completely reversed the anticoagulation effect of rivaroxaban in healthy subjects, but had no influence on the anticoagulation effect of dabigatran at the dose used in this study. This information may well influence the choice of alternatives to anticoagulant therapy that we can choose. I'm Peter Block, and this is a CardioSource Heart Minute.